Joining us, we have a full lineup of guests for our main topic this morning. We are pleased to welcome Dr. David Lam, who's the lawmaker for the Medical and Health Services Functional Constituency, Ms. Chung Sao Chu is a pharmacist and chair of the Hong Kong Pharmaceutical Care Foundation, and Dickie Chow. Dickie Chow's senior research manager and head of healthcare and social innovation at our Hong Kong Foundation. Good morning. Welcome to Backchat. Dr. David Lam, let's go to you first. Do you think prescription charges should rise?
The last revamp of the charges was in 2003. And over 22 years, well, a lot has changed. And if you go to a local restaurant for breakfast, back then it cost you about $22. And now it's well over $40 or even $50. So there has always been an inflation of the cost. And it is quite unusual for something not to have increased in cost over 22 years. So yes, of course, it should be revised. It should be reviewed from time to time, and certainly not only after 22 years.
Right. Given that, good morning, Dr. Lam. This is Mike Rouse. Given that long passage of time, on the other hand, we want increases to be affordable and not such a big shock. Should we be doubling them, do you think, or should we go for something in the middle and then adjust more regularly in future?
Now, the principle, as you mentioned, is to keep it affordable for the vulnerable or the underprivileged. But at the same time, there has to be a sense of responsibility. Disease is not the responsibility of the government. It's also our own responsibility to keep ourselves healthy and to comply with the medical treatment prescribed by the doctor. And medicine comes at a cost. So to increase the cost is really to instill a sense of responsibility. Now, this is something useful, something expensive, and you have to take it according to the doctor's prescription. It's not candies. If you don't like it, tell the doctor and don't get what you're not really seeking.
Right.
I think it's a concept that we have to instill into our public.
Can we go straight to $30, do you think?
It's difficult to say the number. I think there has to be some research as to the affordability. But if you look at how much inflation has been there for 22 years, that would be a proper guideline.
Right. And are doctors giving too many months' worth of supplies to save sort of repeat consultancies? Is this 16 weeks worth of right?
16 weeks for $15, which is what they are charging at the current moment.
But at the moment, as far as I understand, doctors routinely prescribe some drugs for up to a year. So, I mean, this was a separate decision, wasn't it? The hospital authority announced a few months ago that they're planning to change that and reduce the length of most prescriptions. But now you have these two things coming together, Dr. Lam. So you're going to you're going to reduce how much medicine you give to patients, and then you're going to charge them more as well.
Mm-hmm. We're not reducing the amount of medicine given the patient.
Well, at one time.
We're shortening
yes.
the review time. We're shortening the review time, and that concept is important. We're not giving less medicine. We give what patient you need. And, well, I'm still practicing, and now and then we have patients coming, and I use the eHealth to see what medicine are they taking. And then they come up with a very different story. Sometimes they say, oh, yes, I've been given this medicine for a long time, but I've never been taking this. And those are costly medicines. So when I ask them, why haven't you been taking the medicine prescribed by your doctor? They come up with different reasons. Sometimes they said, well, the doctor said this one can come with some side effects, so I'm scared, so I'm not taking.
Right.
And some say, I just feel good without taking that medicine, feeling good without a proper assessment of the blood pressure or blood sugar, for instance. So compliance is a big issue. Now, what we wish to see is that patients understand the medicine are useful, and then they have proper review of the medicine, not only by doctors when they go and see a doctor maybe once a year or once every 6 months. But by shortening the review time, we hope that patients can either see the family doctor in a short period of time or go visit a pharmacist in the community where the pharmacist can review with them have they been taking the drugs properly, and if not, what's the problem, and to explain to them how they should comply better with the prescription or the instruction.
Some of those issues sound like they should be sorted out right at the beginning. I'm going to prescribe these 2 types of medicine for you, take them both, and then come back and see me after 1 month or 3 months or whatever.
Yes. You really don't need to see the doctor again for say, some side effects of drugs or how to take the drug. So if you want to see the patient in a month's time for new prescription, then it's probably better to see a pharmacist. And sometimes, of course, if that affects how good or bad the disease is controlled, then you see a doctor. So a pharmacist has a very strong role in the community and in the co-care of patients. And if a patient is stable enough to see a doctor only after a year's time, the next question is, why should he be seeing the specialist outpatient clinic for that? He should be seeing the family doctor.
Right.
Okay, thank you very, very much for joining us this morning. That was Dr. David Lam, who's lawmaker for the Medical and Health Services Functional Constituency.